You will.
Hi, good afternoon. Welcome to today's online webinar session entitled EMR Assessment Tools to Enhance Your Primary Care Practice, presented by Jocelyn Rowe. Jocelyn Rowe is a primary care nurse practitioner who graduated from the University of Western Ontario with a Bachelor of Science nursing degree, also from Western. She works in the Brockton and area family health team in Walkerton, where she is a member of the EMR Super User Committee. Jocelyn is an NP lead for the EMR initiative. She's an EMR trainer in her practice and has developed many EMR tools to help improve office efficiency and patient care. Jocelyn is one of our nurse peer leaders for the OntarioMD RNAO Collaborative Peer Leader Program. Please note that this webinar will be recorded and the recorded sessions will be posted on the RNAO website. Please feel free to also connect with myself, Tanya Costa, to obtain the recorded link. At the time, all participants are in listening mode and automatically muted for the presentation portion of the session. There will be an opportunity to ask questions at the end of the presentation, and there are two ways to ask your question. The first option is to type your question in the chat box on your screen in the next portion of the presentation. The second option is to unmute your line by pressing *7 to ask the questions verbally. So thank you, and I'll turn it over to Jocelyn to begin. And Jocelyn, just a friendly reminder to unmute your line by pressing *7.
So as Tanya said, we're going to talk today about some assessment tools that you may be using or may want to be using in your primary care practices. So to begin, we'll review our objectives for today. I want to briefly just touch on some of the College of Nurses documentation standards, just to make sure that we get that business end out of the way. We're going to have a look at some of the assessment tools currently available to you in your practice that may or may not be using. Discuss the benefits of creating templates that are specific to your practice, and we'll have a look at some of those. And also review our program here at OntarioMD and RNAO, leader program, as Tanya mentioned. Again, unfortunately, so far at the College of Nurses, there isn't a specific standard that addresses electronic documentation because it does present some unique challenges that we need to address in our practices as we start to use electronic documentation more and more. A quote here from College of Nurses that I just wanted to point out: clearly identifying the individual performing the assessment or intervention when documenting. And this is the point that I'd like to make, is especially in practices where the nursing staff may be in a more traditional role. I think it's important that we all acknowledge that we're doing a good job saying that when we place documentation into the EMR, that we're clearly identifying ourselves as the documenter and the assessor. So consider signatures for yourself. Make sure that your sign-in password is confidential, that you're also not signing in under someone else's name if you're going to be documenting, and that you're changing your passwords frequently. And this is all standards that we need to be following as nurses across the board. So to start, there are very, very, very many standardized tools that we can access for our EMR use in our practices. Standardized tools are excellent. They're always evidence-based and tested, widely used. They also provide us with a consistent approach to documenting. So we can be certain that, for example, when we're assessing a child, that we're all using the Rourke record, and therefore we're all assessing these individuals with at the same standards. When we use globally, then we can be certain, and this becomes more and more important as we enhance our EMR use, that we can extract that data consistently to either inform our programs, history, and so on. Standardized tools are great in that they provide us with prompts, assessment prompts for newer users. For example, if you have students in your practice or new staff members, then we, again, can be certain we're catching all of those assessment points that we need to be looking for. And also, when entered properly, they can be visually appealing. Considerations with using standardized tools, and I use, again, the Rourke record as an example. We need to be certain that some of your organization is ensuring that you're abiding by copyright rules and licensing agreements and so on. So make sure before you're using those standardized tools or EMR that you're contacting the developers of those tools, ensuring that you are legally able to be using them in your EMR. I've personally encountered examples in the past where we've had the legal ability to use a paper version of a tool, but not necessarily an electronic version. So please always make sure that you're checking into that. And also ensuring when these tools go into your EMR that there is a place, again, for that signature, that you can identify yourself as the person completing that assessment. So as I said before about the Rourke record, I'm sure you've seen this before in their practices, but just to highlight a few things, there is a newer version available as of this year, and there's both national and Ontario versions to capture what's important to us here in this province. So you can access those online at rourkebabyrecord.ca, and again, that's where you can check in about the licensing fees and so on. I know there are lots of practices that have created their own templates based off of this, but I think most EMR companies will have agreement with the developers of the Rourke to ensure that we can use that in our practice. Another great assessment tool is the Greig health record, which I think is used a little less commonly than the Rourke. It's an evidence-based tool, again, and health promotion guide for those kids aged 6 to 17. There's levels of evidence indicated right on the form when you're making your teaching points. It's endorsed by the College of Family Physicians and by the Canadian Pediatric Society. And it's great because it encompasses all aspects of assessment on these children. So psychosocial assessment, how is the child doing in school and socially, nutrition questions, education, immunization, and of course the physical exam. So that exam is very small, I realize, but this is the example of what the Greig looks like in its original state, and as you can see, it's pretty comprehensive. So that's an excellent one to be looking at if you're not already using that in your practice. Just looking at the pediatric population, there is, for I would say probably most EMRs, the ability to print out for parents what immunizations the child has received. The one that we happen to use looks almost identical to the format of the traditional yellow card. Those are available to you. We will also be using the World Health Organization growth charts, and those have recently been updated this summer as well. And those can be accessed through the Dietitians of Canada website. There's also the Nipissing developmental screen. That some of that is incorporated into the Rourke and the Greig health assessment, but also a great tool to be looking at in your practice. And certainly, consideration is to, if you have specific handouts, for example, nutrition handouts or how to manage behavior in children, that type of thing, often your EMR will have the ability to stamp those handouts right in there and print them off of your EMR for your parents. Adult population, in terms of preventative care assessments, and as we know, there's been a lot of change in terms of how we're looking at doing complete physicals and so on for adults. One great checklist and form that's been in use for many years is the Preventative Care Checklist form. So that was developed by the Canadian Task Force on Preventative Care several years ago. It's endorsed again by the College of Family Physicians, and all the levels of evidence are also indicated on that form too. So you're doing evidence-based assessment and teaching with your patients. Here an example. Again, I apologize because it's small, but I did want to be able to show you the entire form of what that checklist looks for. So you either contact the Canadian Task Force to request their permission to use this in its original state in your EMR, or use this to base your form off of. So forms out there also. I use the word forms because that's what they're called in our EMR. But there's many disease forms that we can draw upon. Obviously, I think one of the more familiar ones is the diabetes form. That can be accessed at diabetes.ca if you're not already using that. And again, put out a Canadian Diabetes Association. So it's a flow sheet that you can use over several visits, and there are more than one version available to you, so you can actually choose what best suits your practice or your programming. That we use commonly in our clinic, and we've noticed a lot more uptake on screening for folks for COPD since we started using the Canadian Lung Health Test right in the office. So this is available at lung.ca, pardon me, for a test for smokers and ex-smokers over 40. And so one, it sort of influences the patient to start that conversation about smoking cessation, and it prompts us as healthcare providers to ensure that we're screening people adequately according to best evidence. And so we have, this is what it looks like exactly on the lung.ca website. Patients can actually go here themselves and complete the assessment, and then some patient education will pop up for them. Or what we've done at our office is actually put this as a stamp into our EMR. So we pull this up routine when we see people for preventative health visits or for smoking cessation visits, that type of thing. So we really have found this a helpful teaching tool. The chronic disease issue that we're always dealing with is mental health screening, adequate screens for those folks. So consider, again, using some of these, evidence-based tools in your practices as well. And here's some examples of those ones. Be very simple to very complex, depending on what suits your practice. And that's more recently in the spotlight is the core back tool. I'm sure on the call will be familiar with this. We had an education session about this through NPAO, but this is a tool that was developed by Dr. Hamilton Hall, basically as an excellent tool to make sure that we're assessing people properly who come in with low back pain. So it's been an Ontario-wide back pain strategy. There's an educational module for providers online at the effectivepractice.org website at the bottom there, and also access to the tool, the assessment tool, as well as education resources for patients, handouts for patients, action planning tools for self-management. Really excellent tool. And please make sure if you're going to be using this tool that you're certain that you're covering your bases in terms of legalities. And here is the example of the tool. It's quite visually pleasing, but does capture everything that we would be looking for in a very thorough visit on a patient with back pain. To our elderly folks, more of assessments we've been using for years in practice. Again, consider ways of adopting or adapting these tools to include them to your EMR assessments. So I've just listed a few examples that you might want to look into in your own practices. So the cognitive assessment, the MSE, which I'm sure we're all familiar with, and there are numerous falls risk assessment tools out there as well. So moving on to creating custom templates for your practice and what the reasons are we might want to consider doing that. Number one, I find them to be fast, they're efficient, and they streamline the way that we're documenting and assessing people each time. Use these wherever we don't have current tools that meet the needs of our practice, okay? So we can bridge the gap between the evidence and what's practical in your practice. Your templates and current evidence and update as evidence evolves, which is it's key in that most of the time it's very easy to adapt these templates as we go. So as we learn newer evidence about certain clinical conditions, we can update them on our own. And again, going back to the reminders for providers and students, a great way to prompt people to ensure they're completing their assessments. You may include in your templates pieces for follow-up, for education, for goal planning with your patients. And as our EMR systems continue to evolve, the possibilities just improve for us. The possibilities are endless. So a great way is to have someone on your team that's interested in doing this and take on this lead role. Some templates, if you develop them for your own practices, can range from very simple to very comprehensive. Most of the time, doing a simple one takes no more than 5 minutes if you know what information you're looking for. Some examples a simple template would be vital signs collection that you're able to, stamp your name to for the nurses doing more traditional roles in family practice. Collection of a subset of demographic data. So if there's something in your population that you identify, you can do a very quick stamp to capture a yes or no even answer from your patient. And also templates for acute episodic visits, your typical cold or your child with an ear infection or UTI. Also quick to develop and very easy to change in most systems. And so the more complex ones would be obviously a periodic health exam or a preventative health care visit, the chronic disease assessments like smoking cessation, diabetes, that type of thing, assessments for more at-risk populations in your practice. There's a template that we've created just in our EMR very quickly, like I said, under 5 minutes to pull this up, where you can type in the chief complaint, their vital signs, their height, weight, and then stamp your name to that and move on if this information is going on to another provider. And so this is one, pardon me, that we've recently developed at our practice, and this is going to look obviously like my EMR, but the functionalities are pretty well the same across the board for all EMR systems. They just look a little bit different. So, pardon me, I'm starting to lose my voice here. This is our contraception counseling stamp. So we capture this as an encounter in our system, and we've titled it NP contraception. And the reason we've titled it that is we like to keep our stamps that the NPs use in our office all grouped together, so they're easy for us to find. And then you can see my initials also at the top there. So each assessment points are here. They will prompt your students, yourself, what things we need to be looking for, what risks we need to be looking for, what questions we need to be asking, and what educational pieces we need to be offering. And when I click finish at the bottom, this will collapse to just capture the data that I've actually clicked off here. So not everything is going to be captured in the final note, but all of those assessment points are there. So we're looking at doing a more comprehensive assessment, and again, I use the example of the periodic health exam or preventative health care visit. I would suggest that you brainstorm with your colleagues and consider all of the users of this form and try to include everyone's input. I also think it's important to be as thorough as possible, as you saw in my previous encounter, that it's better to have more in there than to be missing any pieces. Always have the option of deleting what you're not going to be using, or in my case, being able to collapse that to just gather the data that you're looking for. So that's probably the best place to start. Example of a more comprehensive health exam, if you will. So at the top, you can see we've titled it. We've called it the NP Female Annual Health Exam. We're still doing these larger visits in our office, basically to capture those people who need screening for cancer, smoking, mental health, that type of thing. So here's a snippet of the top of the form. So you can here's sort of the subjective and social history here. There's also included in this a quick mental health screen. So we can choose not to include that or to include that just based on the patient. We'll have little bits of educational teaching here. So if you can see, if we click smoker or ex-smoker, then the kidney and lung health test will automatically pop up for us. So we can ensure we do that screen. Also, under exercise, we make sure that we make the point of the Canadian Physical Activity Guidelines. Those are available online also, but the recommendations for adults are there. And to this form, again, this is a very comprehensive one. There's not much that we've left out. We have the ability to take in the vitals, do our full physical assessment. We've got all of the major assessment points available there, and again, those will all collapse and only capture what we're looking for when we click off. There's all a box there that we can free text if there's something else that we need to add that doesn't get captured in those check boxes. At the bottom of the form, so under investigations, we've got everything listed there. Did we do it? Did we not? Did we defer something? Did we, is the patient responsible for doing one of these points? In the blue on the left-hand side, those are our lab requisitions. So they're linked right directly to this form. So, for example, our hospital lab is there, our form requisition. So if I click that, then automatically that requisition will pop up for me, as well as our diagnostic, imaging, our cytology requisitions, and so on. And we on immunization, so we can either say that we've discussed it, that we've administered it, prescribed it, and we have a spot for free text if we want to say, for example, that someone's declined a particular immunization. And again, over in the education and counseling, we've listed here, and this is by our group of NPs when we put our heads together, the educational materials and the educational points that we generally make at these particular examinations. So we captured as much there as we could think of, and again, a box for free text, and then anything that we don't use, it will disappear when we collapse the note. So at the very bottom, we've made it quick and easy to make note of when we've suggested follow-up or referral and that type of thing. What you see just below referrals, it comes up in blue and it says FHT. So that is our internal family health team referral form. So if I click that one in blue, what will happen is that automatically it will pop up for me, and I can send that directly to our receptionist from the EMR. So this is a handy one I find too, and again, very quick. This is an example of an older one that we developed years ago. This is a real quick referral form. So when we populate this into our EMR, at the top, the patient's demographics will automatically be entered in there, so you don't have to re-enter that, and we can tab through, state what the issue is, and then all of their medications, their family history, medical history, and will pop up very quickly. So referral forms, can be sent out in a matter of 5 minutes instead of, laboring over what you're trying to say to this particular specialist. So a good, quick one to consider developing for your team. So again, we visit the idea of making templates that are customized to our particular practice, and there's other functions that you might want to consider. So as you can see in my example, we've been able to access requisitions and so on there. How to make your forms or your templates easy and straightforward and efficient and quick for you. So are you able to print additional materials directly from your EMR? Can you access those requisitions? Automatically pull up a referral form if you needed it? Could you, from that original form, send messages to yourself to remind you to follow up, or messages to your colleagues, or have them book in for follow-up? So here and go looking for what little details you might be able to capitalize on with your own EMR system. Considerations, and this is sort of a learning process for each practice, but as I had mentioned before, I often recommend that you group like assessments together for easier access, meaning that if you have a team of RNs that is doing certain health education appointments like smoking cessation or diabetes, you could group those forms together that they commonly use so they're easy to access and easy to find. Also, an opportunity to expand on existing tools. So if you're doing a particular program and you might be using that diabetes form, but there's also another piece of information that's not captured there that your team wants to capture, consider developing your own so you can quickly get that information and then be able to extract that data to base your programming on. Also, don't invent the wheel. If there's other people that, other practices that have tools that they're already using that seem reasonable for your practice to use, ask and share that information. Also, repackage basically the wheel to suit your own needs. If there's something there that's just almost hits it but not quite, then consider just adapting that for your own practice. And ensure that you're getting input from all of your colleagues, because it is amazing if you sit around a table for 5 or 10 minutes, how quickly something like that can come together and how you might miss some really key points if you're not asking. Another one of my tips is to assign one staff member to keep those custom templates or custom forms up to date and keep adding. So we at our family health team, especially amongst the NPs, that's generally me, we keep a running list amongst the NPs of things we'd like to add to our assessment. So I'll often receive emails and say, hey, have you considered doing this orthotic template for our group, and then we will tackle that as a group when time arises. And review your assessment tools routinely, like at staff meetings is a really good time to view, what's new, what are we using, what aren't we using, how can we clean up the system, what should we expand on. So by the end of my formal presentation on the assessment tools, I just wanted to move on and use a few minutes of your time to talk about our OntarioMD RNAO Collaborative Peer Leader Program, and you mentioned at the beginning. So this is a provincial component of the Canada Health Infoway Pan-Canadian Clinician Peer Support Network Program, which is a mouthful. And at OntarioMD, there was only physician and clinic peer leaders, and with time, they brought on a group of nurses across the province using various different EMRs to help support you in your practices. So, the key target was to help people with EMR adoption and implementation. I know now most of the physicians in the province are using EMRs. I believe we're at about 80%. Can provide you with access to some information and resources online. And the ultimate goal here is to improve patient care and practice efficiency. We provide you with free peer support for primary care nurses and NPs, for physicians, allied health professionals, and even your admin and IT staff. We can do engagements in person or by phone or by webinar, by email. Nurse peer leaders are also actively involved in the OntarioMD working groups, steering committees, and projects aimed at supporting EMR users. So what type of support can we offer? Meeting with a peer leader provides you the opportunity for accessing EMR resources, and that's that don't reinvent the wheel. See if someone else has got something available that they can offer you, and we're happy to share. Sharing experiences and best practices, participating in on-site or webinar demos, and tips and tricks to optimize EMR use. And this is part of a larger EMR webinar series that we at OntarioMD RNAO are promoting September through December of this year. So if you'd like to register for the next sessions, then you can register at rnao.ca. Have at RNAO a great community of practice around EMR use, eHealth initiative. So that's just a snippet there, what that looks like, and the website's there at the bottom. So have a look there and get signed up with the communities of practice. Or to talk to one of the peer leaders, you can contact Tanya, who is hosting this webinar today. There's Tanya's information, phone number, email, and also you can access us through OntarioMD.ca. So right now, for questions or comments, if you have anything that you'd like to share that you're doing exciting at your practice, we're happy to hear.
Excellent. If anybody has questions on the line, just a reminder, it's *7 to unmute your line. Alternatively, you can type in your questions on the chat box.
Jocelyn, if there's a tool that's readily available to the public on a website, like the Lung Association has that lung tool on it, the lung test, do you still have to contact them to get approval to use it, like to turn it into a stamp to put it on the EMR?
I think if it's accessed by public through the website, generally not. But I do always recommend that you check before you start adapting it for your own EMR use. I'd hate to see anyone run into any legal troubles, but generally not in my experience. But again, it doesn't hurt to send a quick email just to ensure your safety there.
Okay, thank you.
Other questions? I just received a message in the chat box just saying, thank you, Jocelyn. And, oh, the question's just going too fast. So there's a question from someone online that says, some EMRs are easier than others to create templates and flow sheets. What advice can you have to facilitate that and others cannot access? Then what do you?
Oh, so what I would recommend is that you have someone at your organization who's really skilled at using those functions in your EMR, because it can be tricky even to keep up with updates and so on. What's the easiest way to enter that information into your EMR? And I agree, some are definitely easier than others, but most of those functions are there. So draw on the people within your organization or nearby that have experience with that, and also you can contact us too. We have peers, like I said, physicians, clinic managers, and nurses and NPs that are using pretty well all of the common EMRs in Ontario. So if we can be of any help, please let us know. But do draw on those resources within your own organizations. Usually there's a great super user. We have one who's excellent in our team at doing searches and so on. So we draw on her as opposed to go looking for that information on our own.
Great, thank you. Any questions? We've just had one online just saying thank you for this presentation. It gave me a good overview. This will help me with my knowledge of EMR use as I return to the nursing workforce. So that's that. Other questions? I just want to thank Jocelyn. If you do have any other questions that you think of after the presentation, feel free to email myself, Tanya Costa. Jocelyn's presentation will be saved and archived on the Communities of Practice and on the RNAO website under the OntarioMD project. So again, feel free to email me and I can send you the link. So thank you, Jocelyn, for taking the time and presenting to us today.
Thank you.
Great. Thanks for all of you for taking time out of your busy schedule to attend.